Good afternoon, preppers. Welcome to Goshen Prepping. I think you'll find this video to be very enlightening to help you understand when it comes to wounds, wound closure, infections, and such. Now, before we jump into it, here's my disclaimer. Although I was a licensed physician, I am no longer one. I received a brain injury in the Gulf War, and I can't remember half the facts anymore, so instead, I get to talk to you about this stuff. So I always recommend do not perform these things at home yourself, but actually go to a licensed physician to have it done. Now, with that in mind, if crap hits the fan, you may not have any choice. There may not be any doctors, hospitals, nurses, EMTs, etc. So you may actually have to do this stuff on your own in the future. So I highly recommend some of the things I'm going to show you in this video you're going to want to stock up on. Now, when it comes to wounds, so let's say you get a big gash in your arm, there's a couple things why we'd give sutures for it, by the way. First off, actually, is risk of infection, because obviously, your skin's amazing, by the way. It's really good at keeping stuff out, dirt, bacteria, cooties, etc. And so if you actually get a rip in that skin, or if you actually have a hole in your body, that's where you get infections in, like the flu and stuff. Well, infections can actually get in there too. So obviously you want to be able to have it cleaned out. Now, the second reason we actually have sutures too, in our modern day, especially if you get like a cut on the face, a well-trained physician will suture it in a way that it's going to drastically minimize scarring. Crap hits the fan, you may not have any choice. And what? People dig scars. Chicks dig scars. Isn't that the idiom people use? So we're going to focus, obviously, on risk of infection. So you're going to be able to wash out and irrigate the cut. Now, some of the things we use, and some of the stuff I'll put up on for links for this, some of the things it's difficult to get without being a physician, but you can try. This is called a Surgis scrub, or a surgical scrub. It's really called a BD Easy Scrub 408. It actually has chloroxylenol in there, which actually helps clean it. But you can actually get the scrubs without the chemical in there that helps clean it, and you can actually use your own chemical per se if you want to do that. But this actually works really well for scrubbing it out. But honestly, you may actually be able to get away without actually using this in the first place. Irrigating the wound is the most important thing you want to focus on. And if you're going to irrigate it, just simply running cold, clean water will work well. But if you can actually make a saline solution, it's even better. If you're going to make your own saline solution, it's really easy. Just use 2 teaspoons of regular table salt mixed in 4 cups of warm water, which will help dissolve it. Or for a larger amount, 8 tablespoons of salt in a gallon of distilled water. Now, it's always best we use distilled water for these. If crap hits the fan, you may not have distilled water. You're going to have to get the cleanest water you can. But the salt will help kill a lot of the organisms in there. In fact, they'll kill all of them. So it actually will become, practically speaking, sterile water. Now, a lot of people talk about and argue what's the best thing to pour on a cut, hydrogen peroxide or rubbing alcohol, or even liquor. We always say in prepping, stock up in liquor, but unless that liquor is 70% alcohol or 140 proof, it's not going to do a great job. Sure, it'll kill some of the organisms in there. And the problem with hydrogen peroxide and rubbing alcohol is they'll actually will damage your tissue too. You really want to just go for clean water and irrigate it and continuously run it for 5 minutes to try to get it out of there. Now, a lot of times people are careful. Oh, don't touch it. It might start bleeding. The bleeding is good. The bleeding coming through will help irrigate it because you already have your immune system in there, like white blood cells, for example, will help fight off infection. So having a little bleeding in there is okay. In fact, if you ever get a puncture wound where something just stabs you or maybe you step on a nail, those are actually the most problematic because they usually don't have a lot of bleeding. You want to encourage bleeding in those situations. But continuously rinse for 5 minutes and you'll be good to go. All right. Furthermore, Neosporin is something we want to look at too, or some type of antibiotic ointment. Putting on there is a really good idea. Now, rinse it all out, get all the dirt out, 5 minutes. Again, I'm not telling you how to do this. This is crap hits the fan, or this is how we do it. Rinse out, get all the dirts and leaves and cat fur out of there, whatever's in the cut, and make it nice and clean. Then a very thin layer of antibiotic ointment will help as well. All right, now when you're actually going to be putting it together, one of the problems that we run into, being a layperson now, is we don't have access to like Lidocaine, for example, is what we inject on there. There's a few different options you can look at. Number one is, well, maybe you actually have like a solar generator and you have an ice machine. Ice works very well because will feel cold, tingly, and then finally the pain will go away. It's actually numb. And you can actually do very well in, like, for example, if you want to risk suturing, whatever the case may be, and putting it back together once that phase hits. But you have to be quick, obviously, before your arm starts thawing out in that location. Not to mention, the coolness is actually going to decrease inflammation and decrease bleeding, which is going to help you out as well. You can also show you, and I don't have any with me, I'll go ahead and show you a picture of it. These are called lidocaine sprays. They're 5% lidocaine, which can actually be applied topically. That's something you can do too. So you can see we have a few options when it comes to trying to numb it up. I mean, some people just rough it and say, if you watch Rambo, they'll just sew it up and off you'll go. All right, so sewing up things it can be most overrated, mind you, because when you suture, and you can actually go online, I'll put a link for these below as well, and buy like a practice suturing kit, practice kit. And they do this because, I'm sure there's people like med students who buy these practice suturing kits. No, they don't. They just get them from the hospital. And they obviously sell these for people who want to do suturing on their own or stock up on this because they're real sutures. But, if you can actually find an orange and practice suturing with an orange, that usually works very well. Slice it, even like a jagged slice, and just practice. But again, the suturing is for two things. One, to make sure infection doesn't get in. You really don't have to do an amazing job with suturing to keep the infection out, as long as it's closed up. But you're going to have a big gaping scar. And that's another thing too. If you actually are well versed in suturing, well, it's also about to minimize scarring for the patient. Crap hits the fan, you may not have to worry about that. But suturing itself really isn't something you really necessarily have to jump into specifically. We do have options like, a stapler. Disposable skin staplers are awesome. They're inexpensive. It's very quick, just ka-chunk, and actually put all the skin together. Obviously, we're looking at a pretty big gashing cut for this. So if you have a big cut, this is something you're going to want to be able to use rather than sutures anyway. And of course, we also have the good old-fashioned Steri Strips. Steri Strips honestly work well, but the problem is, since you probably irrigated and it's probably wet and maybe still have some active bleeding, it will actually make it so sometimes the strips don't stick to the skin as well. In a worst case scenario, you can actually use the Steri Strips with some super glue and put it on there. Now, here's an important thing for this. People think, well, how will I get it off? You don't need to get it off. You can let it sit on there for a couple months. Eventually, the super glue in your skin, as your skin regenerates, it'll fall off on its own anyway. So don't worry about that as well. Or these are the coolest things that are out now, and I would recommend getting one of these, an emergency laceration closure kit. These are actually relatively inexpensive. And you can see in the picture here, instead of simply just putting you try to hold it closed with a Steri Strip, you put this on one side and each side of the cut, then you pull the piece together and tape it down, and that's actually going to help close it as well. We have this one. We have a multiple kit from Senvok. And again, I'll put links below for all of these. Now, again, if you do go into getting some sutures, that's completely up to you. I always keep a bunch on hand. Here's some Vicryl. This is the braided suture that's disposable. There's all kinds of things like that. I would recommend having that. If you can even find them, actually finding like a little suture kit that actually has some little hemostats or scissors and stuff in there. I always have in my kit some EMT shears, which work very well. But again, here's one of those assorted suture kits you can get for practicing. But they're real sutures. So obviously it has a whole bunch of different ones on here for different braids and stuff on there. All right, so a couple things you want to look at. And again, you need to check with a doctor for all this stuff. Don't be suturing at home or doing any of these things and practicing medicine without a license. I'm actually verbally telling you that. But crap hits the fan, yeah, you may not have a choice. But there's two things you have to look at. Number one is if you do have an infection, you didn't get all the debris and stuff out, you'll definitely see some problems in that area. And you may actually have to, if crap hits the fan, I'm not telling you to do this, you may have to cut the area back open and let it drain. Because sometimes you'll actually see the area start to really go up and you'll start seeing a discoloring. In fact, you'll actually sometimes see red stripes going up an arm, for example, which shows there's an infection going on there. That's really bad news. And you're going to really have to try to find somebody who has antibiotics or use one of your antibiotic alternates that we've kind of discussed in the past. Second thing too is bleeding. Trying to actually suture up and control bleeding in itself can be difficult because if we're talking about simply your skin being cut, that's one thing. But if you've been stabbed, you may have actually hit an artery below or an organ, and suturing on the skin is not going to fix that situation. In those situations, even more, I'm already telling you not to do surgery on yourself anyway or on somebody you know. You need to go see a doctor or go to a hospital. But even more so in those situations, it's even more vitally dangerous because you're not going to know how to go down inside the body and stitch up a liver, stitch up an artery. These are trained specialists who know how to do these things. It's quite difficult and extensive. So lots of things to look at. I would at least, just in case you have some very superficial wounds, have these things in stock. And I'm sure a lot of you actually have medical training too. And I'm sure there's actually advice you can give. I would love to see that advice in the comments below. What are the things you would actually talk about in numbing it up? What about what would you use to try to close up the area? Or maybe you've actually had some really good experiences, well, not good for the people, but experiences you can share and talk about what's actually worked well for you. So we're a community, all of us. So let's go ahead and get some conversation going below in the comments and on our Facebook page too. Thank you for watching.